Good morning, good afternoon, and warm greetings to everyone joining us today. On behalf of the organizing team, I'm honored to welcome you to this important regional webinar on the Global Fund Grant Cycle 7 adaptation and the upcoming reprioritization process. My name is Ika. I will be moderating the whole webinar today. Um, First of all, I would like to thank everyone for taking the time to be here, especially knowing many of you are celebrating Eid al-Adha and juggling with the multiple responsibility in your community and also organization. Um, as many of you know, the Global Fund is adjusting current cycle of the grant due to the funding situation. This is include the mid-cycle reduction in grant amount, with countries expected to reprioritize and revise their grant between June and September this year. The focus is on preserving life-saving service for HIV, TB, and malaria. Today's session has several key objectives, including to provide clear and timely updates on the Global Fund GC7 adaptation measure and what's ahead, to unpack the implication of the reprioritization process, what's changing, and where we need to act, to identify practical entry points for communities and civil society to meaningful engage, and also to create safe space for open discussion on the challenge you are seeing and the support you may need as the process unfolds in your country. In this webinar, we have our interpreter from Bahasa Indonesia and Hindi with us. So please select the translation option to hear which language you want to listen. And also please keep yourself on mute when you are not speaking. Without further ado, let's begin the webinar. I would like to invite Rachel Ong, the Regional Coordinator of GFAN AP, to give the opening remarks. Rachel, over to you.
Great. Hi, everybody. Thank you for joining us. And Eid Mubarak to some of our colleagues that are in celebrating a very important family day today. Thank you for joining us, given your busy schedules, and we hope that you'll be able to share share the information that we're sharing with you, as well as be able to share some of the information that you have at the country level with us, for us to be able to find ways to support the work that you're doing more effectively and better. Without further ado, I'm going to give you back to the moderator.
Thank you, Rachel. Now I would like to invite Chinmay Kumar, Coordinator of Asia Pacific Learning Hub, to give the opening remarks.
Thank you, Ika. Good afternoon, all, and welcome everyone for the today's important webinar on GC7 grant adaptation and the path forward for our Asia Pacific region. First of all, thank you for taking time to join us today. We truly appreciate your commitment to staying informed on this critical development. Today's session is designed to ensure that you have informed context, as well as a platform where you can understand these changes as well as influence the processes at your country level. During this pivotal moment, the Global Fund grant implementation cycle, the adaptations being made for GC7 as well as GC6 have significant implications for how we can continue our important work in combating the three diseases across the region. We encourage you to engage actively. Please requesting you all to ask questions as well as share your experiences and help us to identify both the obstacles and opportunities that lie ahead. Thank you. Ika, over to you.
Thank you so much, Chinmay. Now I would like to invite Kana Dharmaraja, the lead HIV and health financing from Frontline AIDS. Kana, over to you.
No, thank you very much, and thank you for having Frontline AIDS as part of this webinar. I think as a global partnership, it is important that we are part of webinars in different spaces to share information, given the changing global financial and multilateral systems. It is more important than ever now to have society communities to be part of these discussions, and in country, at regional and global level. So thank you very much. I'm going to hand it over.
Thank you so much. And I would like to ask the participant to drop and also introducing themselves in the chat box. I know that some of you already done it, so please keep doing that so we know from which country you are listening us from. Now I would like to invite Anna Malsen from the Global Fund Community Rights and Gender. So Anna will walk us through the reprioritization process and what is mean for key population programming, CRG intervention, and also opportunity for civil society engagement. Anna, over to you.
Thank you, Ika. Good afternoon, good evening, all. Thanks for taking your time to join this really important webinar. This, just firstly up front from the Global Fund, is not something we want to be doing. It's a really difficult time for everybody, and we acknowledge that. And yeah, it's just going to be a very difficult journey ahead. But together we can try to engage as best as possible in this process. So firstly, some of you may have seen contents of this presentation before, so apologies in advance. We're rolling out this presentation as far and wide as possible. And this is really around the programmatic reprioritization and revisions to the Global Fund grants in Grant Cycle 7. So next slide. So the principles of this mid-cycle grant adaptation, and recalling we've never ever done something like this before at the Global Fund. This is the first time that we've had to make a downward revision in our grants mid-cycle. So obviously the world that we are operating in is vastly different to what it was 6 months ago, 7 months ago. And this is impacting all of us, not just at Global Fund but all of your programs. And we need to work together to support principal recipients and the country coordinating mechanisms and our community partners and stakeholders, as well as technical partners, to support how we can optimize the best use of the Global Fund money that is available. We had a series of approaches. The first one, which has already been in place, which you have heard of, is around deferring or pausing agreed activities. The purpose of this was to slow down spending, to make sure that we had enough funds for our commitments. After that process, which is mostly finished but ongoing in some places, we'll be entering into a reprioritization process. We've been waiting to hear, particularly from the US, what money may come to us. So the internal finance team has been working really hard to advance commitments from other donors as part of these saving measures from the deferral, to try and get to the best possible place to make a call on how much we will need to reduce allocations from grants. We don't, I mean, it's clear, I need to say up front, we don't have any percentage to give you at the moment. There's no fixed number, and that communication will come within the next month, and that's on another slide. So this process we're entering into in June, July, and August particularly is about reprioritization of the grants, which the allocations will be in line with the reduced allocations. We need to do that by the end of September, so we can move on and continue with implementation. So next. So this is the important part. This is the timelines. So we are now just at the start of June, and the country teams have been working with the PRs and CCMs during this time for that slowdown spending. That gives enough time for the Secretariat to sort of get further intelligence about how much resources we will have in the bank account. And then we had originally planned by mid-June to be sending out letters to the PRs and CCMs with the revised country envelopes. This timeline has shifted just a little bit. So we now expect by the end of June, and so no later than the 30th of June, PRs and CCMs will receive letters with the revised country funding envelopes and the illustrative grant amounts. If your country has one grant, there will not be a process that requires adjustments in country. But if there's multiple grants, there is the opportunity for CCMs to review those illustrative grant amounts and make some internal discussions about whether some money needs to be shifted from one disease to another to cater for any of those significant gaps that may have been left in the wake of or where there was high codependency. So those ones will be difficult discussions. And there'll be an opportunity. There's a 2-week window for the CCMs. Once those letters come, all of the CCM members will receive that letter as well as the PRs. And in that 2-week period, we are recommending that the CCMs meet to discuss those allocations and either endorse on a no objection basis or review, make changes to those allocations and send that back to the Global Fund. The CCM chair and the co-chair and the civil society representative, if not one of those two positions, will need to endorse those allocations. If there's no objection, there's no need to do the endorsement. As soon as that's back to the Global Fund, the process of reviewing the current grants in line with those reduced allocation, well, most of it's actually sort of already beginning because of the slowdown, but that process will start there. It will be a quick process. What this timeline sort of doesn't indicate is actually by the 19th of August, all of those grants need to sort of be back with the Secretariat because we have a hard deadline by the end of September to get all of the grant revisions completed. Once the conversations and the discussions have happened at country, we want this to be as inclusive as possible. We know that that is very challenging in many circumstances, so we are here to help. But once there's an agreement on what the revised grant budgets are, the PR needs to submit that at the same time to the Secretariat and the CCM. The CCM then has a 2-week period again to review those documents. Ideally, we want the PR to present to the full CCM where those changes are. As part of the revision form, there will be a summary table that indicates the shifts in modules, the shifts in interventions, and most importantly, the changes in implementation arrangements. This is where we would be able to see at the Secretariat if there's any red flags in terms of big shifts away from civil society community implementers or not. So that's really key. As CCM members and as constituents in your CCMs, please keep an eye out for that. That's really, really critical. We've been doing these information sessions as well with the technical partners that sit on CCM, so UNAIDS, WHO, etc. And also asking them to support communities at the table as part of those discussions. So please use every avenue to sort of advocate and ensure that those revisions and discussions are transparent. Next. As agreed at the board, it's just really focusing around life-saving services in the context of programmatic reprioritization. And it's not just about the life-saving services, it's enabling the access to those life-saving services for HIV, TB, and malaria programs. And those core priorities need to continue to be covered as much as possible within the reduced allocation. We know that this is a really difficult and contentious interpretations at country level. Context is everything, but the intent is really around ensuring treatment care and continuity for HIV, ensuring continued treatment and diagnosis for TB. And we know specifically for TB, for example, that 60% of new diagnoses are reached by communities, outreach and providers. So it's a really critical part of maintaining access for TB diagnosis and treatment, as well as similarly for case management for malaria. As part of the access, it's really important that populations and communities most impacted by this, that in the reprioritization, the interventions to remove barriers to accessing services remain essential health and community systems and service delivery platforms and integration. working together. We know there's a lot of talk around integration. That, of course, is concerning if it's done fast without thinking through the implications. And of course, some populations will never be able to access general services, and we need to ensure that those services remain so those populations are able to access services. Next. So preparing for the reprioritization, we really encourage the principal recipients, CCM and partners to use this time to start thinking already now about what the lower financial ceilings implications may be. So within your own grants and with your own as SRs, SSRs, or implementing partners or as PRs, really start looking now as what are some of the really essential priorities, considering the access and equity across population and services, and analysing any of those GC7 interventions to reprioritise. Country context is everything. Our guidance that we will be providing is quite broad because the context is different in every case. But the decision making, and we're putting this in every document as much as possible, should really be between all partners and stakeholders, so government, communities, civil society, and also, more importantly, looking across all sources of funds, so both domestic and international. Next. It's a country level exercise, and we're really encouraging the epidemiological context, that we know where your populations are, where the geographical reach needs to be, those most impacted by HIV, TB and malaria, they need to be front and center as part of the decision making. But this is a partnership landscape, and engagement of community and technical partners needs to happen. We, of course, look and continue, and always the Global Fund has value for money and the sustainability of supply and the service delivery factors. So what are the minimal packages of services needed to deliver a quality service in this setting? Where are there opportunities for efficiency gains and an appropriate integration? And what is the minimum type of monitoring needed to inform program decision making? And I'll leave the domestic financing one, so we can go to the next slide. So the guidance that we provide, and we're not technically calling it guidance, our approach, our reprioritization approach, it's not technical guidance. So they are priorities that provide insight in how to order prioritization around life-saving health products and services while increasing cost effectiveness, considerations on enabling access, aligning with normative guidance from technical partners. So both UNAIDS, WHO at the moment are working on guidance also as well, not just for Global Fund, but in general around the reduced donor landscape. What is our additive role as Global Fund with domestic financing? Encouraging health service and system integration where it makes sense, and health product market access sustainability. These are all foundations anyway that we will be moving towards as part of Grant Cycle 8. What our approach does not do, it is not specifying a minimum package of services. We're not analysing the shift in partner landscape or domestic financing. That needs to be done at country level. And it does not cover the Global Fund catalytic investment matching funds multi-country approaches or the C19RM funding. Next. So for HIV, the core priorities are ensuring treatment continuity, expanding the cohort for people newly diagnosed or re-engaging with care, ensuring services to diagnose and manage TB and advanced HIV disease, CD4 testing, etc. Ensuring HIV testing for people with higher HIV risk, identifying pregnant women living with HIV and preventing vertical transmission, again, key in the A and C in high burden settings, ensuring primary HIV prevention services, condoms, PrEP, etc., and maintaining harm reduction services. This one is very specific and particular, and we really want to make sure that that's clear, that this is a priority to maintain. Across all of these priorities are the necessary support functions. At opportunities, explore integration with the primary healthcare services. sustaining human rights programming and advocacy that most impact service access. This is really critical. And this is the message that we want the communities to hear loud and clear and keep fighting for, that the peer outreach is critical. It needs to be maintained and at the same, and needing to be paid for those services. And the rest we can move on. For TB, again, diagnosis and treatment. We know that some of those diagnostics are expensive, but they are critical for TB programming, while addressing stigma, discrimination, human rights, and gender-related barriers to timely, effective TB care. Maintaining HIV testing for people with TB and initiating ART. Continuing TB screening for people living with HIV, diabetes, and people who are undernourished. Continuing new screening tools and diagnosis and the shorter treatment regimens. Focus on key and vulnerable populations and high incident geographic areas. So again, using your EPI data to drive decision making. Continue contact investigation, prioritizing children and linking to treatment and prevention. Integrated active case finding for TB and other diseases. Maintaining preventative treatment for people living with HIV and children under 5. We also recommend for pregnant women, and using symptom-based screening for TPT and antigen-based skin testing for household contacts. Again, engaging communities along the cascade of care is a particular priority for TB. Next. I'll just skip in the interest of time. We'll be able to share this presentation with you all. And then for malaria, particularly ensuring case management as an absolute priority, ensuring effective diagnosis and treatment is available, ensuring sufficient support to provide access to those quality services with a focus of leaving no one behind. We know particularly in the Asia Pacific region, there is good progress towards elimination. So that really is about extending the reach and leaving no one behind. Targeting prevention services first to the most vulnerable and the highest burden. Universal vector control coverage where possible. So then looking for most efficient and effective distribution channels, particularly focusing on the most vulnerable groups. Seasonal malaria chemo prevention, focus on high burden areas in children under 5, and IPTP for pregnancy is integrated as much as possible through or covered by national funding where possible. Surveillance, so continuing to support those really important efforts on subnational tailoring, transitioning from large-scale surveys to more efficient monitoring approaches. They're sort of the key highlights. And again, maintaining community health workers for integrated services here is a critical priority. Next. So as part of this, we're working really hard internally within the Secretariat, so across not just the technical teams, but with the country teams in GMD, to ensure this message of deliberately integrating not just RSSH, but human rights, gender, and community systems is essential across these all disease priorities. So we cannot just provide commodities. It's about access. So the quality services to deliver access to care require those human resources. They require community health workers. They require access to diagnostic services and those relevant capacity and capabilities, including gender responsiveness. These systems are important still for ensuring longer-term self-reliance for countries and facing future pandemics. Effective integration of HIV, TB, and malaria services at primary care level is essential for efficiency. But again, keeping in mind that is not all populations will be able to access those services. So, and doing our best as possible to protect those services that really serve the key and vulnerable and underserved populations is critical for an effective response. I think this is really critical in the Asia Pacific context. And improved health delivery, that monitoring and feedback loop, not just about health service data, but also more importantly, identifying human rights and gender-related barriers to health progress. Next. There's a lot of slides here around RSSH. We'll just go to the community systems one in the interest of time. So next slide. I think it's, yes, this one. So we have had 1,001 questions already about community-led monitoring. So I want to assure everyone this absolutely remains a priority. And for community systems, it's about protecting the investments that contribute to improving linkage, referral, and human rights support between formal and community health service delivery platforms. So maintaining or mature community-led monitoring programs that provide real-time data on accessibility. We've had some questions around if a country has not yet started CLM, they can still add that to the grant as long as it's, ensuring that it's linked to this, their access and quality of life-saving services. So that's to say you can't not start it, but it needs to be really well designed and connected to the service delivery and quality of care aspects. More importantly, we are recommending continued investment in capacity development of community-led and community-based organisations that support delivery of life-saving services. This must be accelerated, and this is, again, particularly important in the Asia Pacific context where some countries are able to do social contracting. So continuing to invest in the community-led and community-based organisation capacities is critical. Maintaining peer cadres, again, with fair remuneration and supervision to ensure those life-saving services. Where possible, look at expanding peer roles to cover multiple diseases and human rights. Those peer paralegals and other legal redress mechanisms are vital. They're separate and complementary, so they should be maintained as much as possible. Where we can deprioritise, looking at community-led research or advocacy that's not using the CLM data for quality improvement or removal of service barriers, any standalone pilots that operate as parallel to structures without a clear pathway to change, and any feedback mechanisms that sit sort of outside of the national systems. Again, continuing to integrate where possible CLM and investing in support, enabling environments that support social contracting and the delivery of services. Next. Keep going through these. Keep going. Keep going. Okay, that's it. Sorry, I had some more slides there in another one, which was really about what support is available from the Global Fund. So firstly, I can share through NCRG, through our Community Engagement Strategic Initiative, that we have partnered also with Frontline AIDS to support technical assistance up to 10 virtual TAs, that you're able to use any embedded TAA or existing arrangements in the budget into the 25 countries we already operate in for the CESI grants, and where they're finalising the community guidance on reprioritization. Obviously, these learning hubs are a really important part of this process in hosting these webinars, supporting any technical guidance, dissemination of all the information, and support for any rapid engagement in 10 or 15 sort of countries. We have across the different strategic initiatives that includes our Human Rights Strategic Initiative, our Gender Equity Fund, looking at where there's clarifications, troubleshooting calls, and we're sort of maintaining an internal issues log around community engagement. And the COPPA CE has, I think this is less relevant for this region, but support for support in this process. I think I'll leave it there because I'm missing my other slide. But we can support you and we have TA available, and I see there's lots of questions.
Thank you, Anna, for the detailed presentation. I know the people already raising their hand for the question. I would like to invite Daniel. If you have the question for Anna, please feel free.
Yeah, thank you, Anna. for the update. Seems like a few things from what I understand. I'm Daniel Magori from Spiritia Foundation, Indonesia. My organization, one of the community PRs in Indonesia. We have eight PRs in Indonesia. What I understand, the second letter that my organization get as a PR by 16 May, that the mid of June, that's Global Fund will send to us the 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 reduced allocation funding information, the envelope, and then the program reprioritization approach document, and also guidance on revising the grants. But you just update us that it will come the end of June. To let you know that the country team in Indonesia, I update a bit if I have time. We have been earlier working on this to identify the default, so we don't wait the envelope. So the country team, we have a few meeting virtually or hybrid with the CCM, the technical working group, and the country team. So initiate by the country team to start identification the default for 15% per PR. So it's not decision. We know this is not officially decision by Global Fund, but this is just initiative for us to start the divot to identify it. So each of the PR to already identified the default 15% to be ready when the envelope will come, because we don't know the envelope can be for 20% per disease, or it can be in the end just 5%, or the deferred plan will defer, not will start yet. So anything can happen because we know it's very depend on US. We're still waiting US to release 1.3 billion for the second tranche, right? Because the first tranche is 1.8, it should be released. I'm personally still confident. I personally don't know prove it for that. The 1.3 billion will release for the second one, but I don't know for the third one. So with that, we have a meeting yesterday with the CCM, with the PRs and country team, almost finalized the identification 15%. It's not easy for Spiritia, especially already influencing the life-saving activities and essential program. But we already have a discussion about how we deal with that, because this is not decision. But we have to make sure the essential and life-saving, it should be continue what it is. So what I need to asking, there are a few things. One, yeah, well, like you said, it will move the envelope, the information will come, the document the end of June. But yesterday, the country team told us in a meeting, potentially in July. But I need to connect with committee. The committee will have a meeting on July. Does Global Fund will submit the document before the committee meeting? There is no connecting on that, the committee recommendation? Or it will be, we have to wait until the committee finalize the recommendation, then the evil envelope, the guidance, and all those things will come to us. That's one thing. The second thing, what we can do do intervention to the Global Fund Secretariat and Committee. As a community in Global and Asia Pacific, is there any room, like we are here today in this Zoom, is there any uh, opportunity for us and can influencing the decision by secretariat or committee about the envelope, about the reprioritization, all those related with our intervention? If yes, then this is become our discussion to those people who attend here, that what we can do. He asked recommendation to the Global Fund Secretariat to make sure the civil society program engagement, also life-saving testing are all related for HIV, TB, malaria. The purpose need for community should be still priority with the bigger size. I know it's not easy for CCM to decide how many percent for each PR to the deferred. It will not come easily. The last question, if let's say with the scenario, US will transfer next week or next 2 weeks, the 1.3. So this deferred plan will defer or it still continue to go? Thank you.
Thank you, Daniel. Anna, would you like me to collect all the question and then you will answer, or okay? Manu?
We can collect the future.
Yeah. Me?
Yeah.
Okay. Yeah. Hi. I'm Manoj Pardesi from National Coalition of People Living with HIV. I saw the process which you said, like April to June and then forward. The biggest missing point which I see is a dialogue with the community, because that is actually will hamper the reprioritization, because the PR's interest and then government interest will um, become first than the community. So I'm also asking the same question which Daniel asked, that is there any room for country team to have a dialogue open with community? Because so far, neither existing PR has initiated that dialogue. The dialogue is happening between Global Fund and PR and Global Fund and government. It's not happening the real priorities of the community. Second thing, the first thing is hampering is the community activity. And just to give you one basic example, like the ORW, the outreach workers, those who are working at ground, the 5% increment, which is immediately stopped. For them, that it's less than $1. It's less than $5, something like that. But that is important for them, and that has stopped. So that's what we want, to have a dialogue with the country team where the reprioritization has to be in consultation with the community. So if there is that space, if not, can we create that space for that? That's the question. Thank you.
Thank you. I think I let Anna to respond to this question first, and then we will open the second round of the question. Anna, over to you.
Great, thank you. Thank you both for really good questions. So Daniel, the timeline will be CCMs receive that letter for the end of June. They cannot receive it any later than the 30th of June. So the July information that you have from the country team seems to be incorrect. So we can just check internally to make sure everyone's communicating the same. In that first 2 weeks of July, you should be preparing for your CCM engagement. It's really great to hear that you've done all this work already as part of the slowdown process. I think you're in a really good place at that approach. And I can probably say we're not going to expect the worst case scenario. And we seem to have some good signals coming from the US, although I don't know what to believe until any money's in a bank account. But I think your approach that you've taken in Indonesia is a really good approach, and that's useful for everybody else to think about. And I think you'll be in a good position when it comes to that. On the Manoj, on the engagement, I hear you loud and clear. So I think you need to immediately raise that with the country team, that as the community implementers and partners, you want to have a dialogue with them. We have been saying internally to the country teams that they need to ensure they're also speaking to the community implementers and partners as part of this. What we do see and hear everywhere is that the smallest pieces of the pie are always getting cut the first. And this is not the right way. It needs, I mean, it doesn't make any sense what you're saying, that they're trying to stop the incremental of such a small amount. And we say also internally, often, particularly the human rights work, the gender work, it's such a tiny, it's like 1%, and it's always the first that sort of gets, it makes no rational sense. So please, if our community rights and gender advisors in the grant management division can flag this, and we can support it. On the dialogue, we know how hard it is. It's really difficult. We will be doing a specific CCM session for civil society representatives particularly in CCMs where we know it's really challenging to engage. And as per the CCM engagement scores. So we're working on that, and in the next 2 or 3 weeks, 2 weeks, hopefully as fast as possible, we'll be doing that in partnership with the communities delegation to give some tips about how to be ready and prepared to engage in that process. Thanks.
Thanks, Anna. We have like 2 questions in the chat box. One is from Sri Hari. How the Global Fund will deal with the grants where we do not have meaningful community engagement and representative at the CCM, particularly malaria and TB? And the second question is from Melanie. We fully understand the priorities set in terms of activity planning and sequencing. Are there any risks of having to reduce management costs in the very short term? Yeah, I think that's all.
Yeah. No?
Is there any more question from the floor? Okay, I'll let Anna to respond to this question first.
Thanks, Sri. Actually, we have flagged also internally around the issue of malaria and TB representation on CCMs. We know that that is not ideal, and that will be a special focus as part of the work we're planning to engage with CCM civil society reps. Also really encourage that there are technical partners sitting around the table that at CCMs that need to equally represent across the 3 diseases. So specifically thinking where there are WHO representatives, they need to be supporting all of the priorities. And in some countries, again, less probably relevant for the Asia Pacific region, malaria programs are going to be hugely impacted. In the Asia Pacific region, TB programs have always been dealing with a resource-constrained environment anyway, so it's not that much different to business as usual in that case, in that sense. But the representation issue is really critical and important to continue, particularly the community support for the TB programming. So we're happy, Sri, if you want to collaborate with us on the CCM engagement, where more the merrier. We really want to make this as useful as possible. And then on the management costs, I think there's, of course, always risks in where there's reducing management costs, not for some PRs where there's probably, where there's, other PRs which can definitely reduce their management costs. It needs to be proportional, and we're advocating internally that we need to really think that it's always lower overheads and costs in civil society organizations, and they need to be protected. Often in grants, they get money to do the activities, but not to fund the core operational costs. We can't contribute even further to that where we've seen, where other money has been funding that and that's no longer available. So as much as possible for the community-led and community-based organizations, we need to try and maintain and protect those core costs. I might be completely in a disagreement with what country team colleagues do, but we are here to support that, and we'll be reviewing that in those revisions that come back. That's why the implementation changes are really important to monitor through the CCM and the revision forms. As always, if you need to flag anything, give us a shout at CRG, and we're happy to see and follow up where we can.
Thanks, Anna. Is there any more question from the floor? Okay, I would like to, since like people keep texting on the chat, I would like to ask Chutarat Wongsuwan to read out their question, and also Fiang. And Sanjay, sorry.
Yes, namaste.
Namaste.
I'm Sanjay Sharma from Nepal. I'm an LGBTI activist and ex-CCM member. So my question is that before the funding alignment during our CCN turnover, we have like the MSMTG and sex worker program will be taken over from the USAID, PEPFAR project, EP, and the drug user and migrant program take over from the Global Fund. So now the term administration, our 21 community-based organizations are terminated. And we are facing problem, even like condom, lubricant, testing. And also we have a community dispensation site, ART center through our clinic. And now the dispensing site also closed, so we have to refer to the ART center, and still 6 months, 7 months, 5 months, we are not going for the viral load and their support thing. So what the Global Fund is thinking about the MSM and TG is the major key affected population in Nepal. So how we can program will be continue. One thing is that, and second thing is that we are the SSR for human rights grant, we have a human rights grant under Respect Home for gender-based violence, and the people from LGBT community who are not open, they take ART from our Respect Home. The Respect Home is like crisis home, but we don't call as a crisis home, we call Respect Home because people facing gender-based violence and they stay there, we providing food them. So still it's not contract with the PR. So that's the problem from our side. One side, the trauma administration, 21 community-based organizations are terminated, and one side, the human rights grant also not signed till now. So that's the major problem for us in the country of Nepal. Thank you.
Thank you, Sanjay. Vieng, are you there?
Hi.
Hi.
Yes. I just have two questions. The first one is, I think that's the how the Global Fund can, look at the administration cost from the PR principal recipient, because this is a lot of money. That's admin cost. I think this is the one of the how to ensure that's the amount of money can allocate for saving life. The second question, I will ask the Global Fund how the portfolio manager who have the power that negotiation where is the country is a civil society and key population is lack of the skill how to negotiate of allocation fund for the priority, because other some country is not really powerful because the government want to move the money priority themselves, but how we can have the support like that. Thank you.
Thank you, Fieng. I think the last question from the chat box is, will the grant adaptation allows a PF revision? Anna, over to you.
Great. So on the last one, it's more easy to answer. On the PF revision, that at the moment is not changing, but it's raised consistently internally. The results team that manages that say that because it's linked to the NSP targets, that this is why it's not being changed. But there is a lot there's a lot of discussion happening internally, and we all are waiting to see what will happen with respect to the performance framework. But as of now, no, it stays the same, which obviously makes it difficult. Sanjay, yeah, really, really important questions. I'm afraid I don't have much insight into the Nepal grant, but I am aware there are many challenges happening there. I will flag it with our community rights and gender advisor to see what's happening and what we can support. Obviously, MSM, TG remain critical key populations that the Global Fund is committed to continuing to support that work. They absolutely remain a priority. I know it's really challenging negotiating within Nepal with the government. So let us follow up on a sidebar for you on that. And Vieng, absolutely, we know that PRs should be reducing their costs, and I also really understand how difficult it is to have with the power imbalance. I have worked extensively in the Asia Pacific region, so really understand how that is. So I think for specific cases, we can support with some TA, some virtual TA, or a small amount of TA to support the engagement or capacity, or getting prepared to engage in those conversations with the PR and the government, or find advocates and others that can speak and influence you all know how to do this. You do it all the time and every day. But we can, yeah, where you need support, let us know, and we'll see if we can provide some additional TA, and Frontline AIDS is here to support that piece of work during this process. Again, I think country teams are very well aware on the administrative costs of PRs, so we'll see how that plays out.
Daniel, I see your hands up. Do
May
you wanna-
I again?
Hello.
Yeah, thank you, Ika. Anna, what I understand from the letter came from Global Fund twice. It's mentioned strongly that the default process is very country ownership. What it means is leading by CCM, not intervention by country team. But country team will do the reviewing process, give the recommendation and other things. But it's not decision, not intervention, the understanding. It's by CCM. If we are reading carefully the letter, there is a time for CCM and the PR to decide by envelope, to divide it by diseases, to divide it by the percentage for each PR in each disease. After 2 weeks, if the CCM, there is no agreement, then we'll go to the Global Fund through the country team, do the intervention, with my word, intervention. That's after 2 weeks, if there is no agreement. So that's the mechanism. What the difficult thing, talking about this, maybe it's not so stressful for me in Indonesia because we, from 8 PRs, we have 4 community PRs. But in many countries, they don't have a community PRs. They just depend on the government PRs. So it's very difficult for them to make it a decision. Decision making is very driving by the PR. Of course, reviewing, controlling, and approving by CCM through technical assistance by technical working group. But it's not as simple as, because it's many CCM in many countries is so driving by government itself, right? And we know the chair of the CCM also is always be government. So it's not easy to make sure the community in the CCM is engaged strongly in the technical working group or in mechanism. That's true. But I was asking, is there any mechanism for us right now as a global communities for key us to the Secretariat of Global Fund right now, or is this too late because the envelope already on the table, just to finalize, or there is a time for us to give a recommendation to make sure that the minimum standard what we expect it will fulfill for community benefit engagement and other thing. That's what I'm thinking. And the second question you don't answer, the connecting committee meeting on July. With this envelope guidelines and all information will come by the end of June, but before the committee meeting. So which is the committee will not relate it with this process, or is there something different thing? That's two things. Thank you.
Thank you, Daniel. You just reminded me. I didn't answer your 2 questions, so thanks again. So on the process for the revised allocations, so once the Secretariat has or they're currently working now to understand the full financial picture that we have in our bank account, and they are looking through a qualitative adjustment process internally. It's not like we do normal for when we're doing a new grant cycle and there's the 3 disease split. Because we are already in implementation, this is a mid-cycle revision. It's looking at adjustments. So any country that has already spent money, it's being applied on those that are not. For countries that are still yet to sign, which there are a few, they will need to apply the reductions across their full or it will be a reduced allocation in general. There's no ability at the moment internally to influence from the outside this qualitative adjustment process. So when the letter comes, it will be the country allocation with an indicative grant budget split. I assume in a lot of cases there won't be that much shifting between grants, but there could potentially be, particularly in countries where there's been a huge impact and codependency with US funding. And that's really shifted the entire implementation arrangement. So they will be very difficult conversations, I assume. So this is where you can influence that. Noting your point that communities, it is very difficult to influence that process. So I think coming as much as possible for your CCM reps to be prepared to engage. And whether it's like we've already made our 15% cut, if that's what you've done. We're not budging from that now. There are other areas that need to be considered as part of that, but you do have that 2-week window. If the CCM and the country and the implementers are all okay with the revised, no one's ever going to be okay with a revised reduction, but that split is okay and that can be lived with. That's a no objection process, but it still needs to be endorsed by the CCM chair, the vice chair. And if none of those two are civil society reps, the civil society rep has to sign. So there's your piece of power. Hold on to that piece of power and engage with that civil society rep on the CCM. Again, I understand not all civil society reps are able to or are representing the full civil society as best as they can, but we need to work within that process. The second piece, I think Daniel, you're referring to the strategy committee, right? So yes, this is going ahead of the strategy committee. So the letters come, the board delegated that down to the secretariat to do. The strategy committee have had insight into how the allocation process is going. But yes, the letters will come before the strategy committee, so they're not connected. The strategy committee will be having a deep dive on the, what we've done for the deprioritization approach, but many of those members have been involved already as part of that process. Does that answer your question?
Yes, thank you, Anna.
Thank you so much once again for your question. In the interest of time, I would like to close this session. Once again, thank you so much, Anna, for being with us today and help us to answer the question. Okay, let's move to the next session. So now we'll hear the next step for community and civil society to influence the process and also availability of the TA or resources available. I would like to invite Chinmay Kumar to present on behalf of the Learning Hub. Over to you, Chinmay.
Thank you. Thank you, Vika. So like today I will be covering mainly how can community engage with the reprioritization process at the country level. It's also important for community to be aware and carefully review the GC7 grant documents of the country, like detailed budget and performance framework. Also, it is important that you should be right now aware as in community, if you want to engage, that what is the status of the implementation of the grant. If you want to know the status, you can reach out to PR, SR, and SSRs to inquire about the status of the implementation. And also, relatively, you have to carefully read the global fund guidelines, like the letters as well as the presentation templates which we see, to understand what is the situation. Share and discuss all these documents with the community and civil society to ensure that common understanding between the communities, as well as the recent ongoing discussions within the country. If there are any questions, we should, as a community, should ask proactively, clarify all the questions with either CCM representatives or the CCM secretariat. Or if we can also reach out to Global Fund in terms of any questions where we want to clarify. And always ensure, agree on the communication modalities as well between CCM community representatives and community to ensure timely information sharing, as well as getting reciprocal feedback as well. Um, in terms of like identifying engagement opportunities, um, having to proactively contacting the CCM secretariat and community, as well as civil society representatives present at the CCM, to inquire about opportunities to participate in the reprioritization as well as review process. Examples, there are CCM meetings happening around this time, so like you can also be part of it. Like it is also important that you utilize or establish a contact point or contact person with PRs and SRs to get the timely information, as well as if you want to take part into those meetings. And also like coordinate community as well as civil society at the same time, where contact community representatives and other community organizations to prepare for the CCM discussions and ensure early alignments on the priority issues. And we already heard like the questions coming related to it. And like it's also important that this process could include conducting a community wide review of grants to identify key priorities and opportunities to optimize and refocus our outreach. Now if we talk of the role of a learning hub during this whole process, so it's like we have always shared timely and relevant information related to the reprioritization through our newsletter, whether it was the letter to PR, community delegation position, or on letter of reprioritization or operational update. Learning hub will be always committed to share all the important information as early as possible. Not only this, the Learning Hub is also collaborating and organizing webinars on the reprioritization so that communities can participate and get opportunities to ask questions and understand the situation well. I'm sure, like, a lot of you might have also attended a webinar last Friday, and same way even today. So like this is what we are also trying to do, to bring community on board and get an opportunity to also ask questions directly to the Global Fund. We also have one very important joint learning hub webinar, which is like led by Asia Pacific Regional Learning Hub in collaboration with the other regional learning hubs from the different regions, which is scheduled to take place after the release of the Global Fund information on programmatic reprioritization guideline after mid-June. So like bringing together community and civil society representatives from Global Fund implementing countries, including CCM members, to unpack and discuss community engagement in GC7 reprioritization and revision. We are trying to reach out one on one at the country level with CCM members to talk about the reprioritization and understand the challenges and provide support to them the way we can. And like we also want you all to please reach out to us and let us know how we can support you if we are facing challenges with the engagement in the reprioritization process. Thank you.
Thank you, Chinmay. Now I would like to invite Kana to share your.
No, thank you very much. And I think Chinmay has covered most of it. The Learning Hub is a key point of contact for the region. But as Anna had said, it is a country process, it's not a government process. So this consultation in countries have to start now. If your countries have not started, or civil society and community have not even had the discussion, it is important to start now. There is very limited technical assistance or funding for consultations. While there is some for some countries, I think even in countries with UNAIDS, WHO, and other technical partners, there is also limited funding. This is not a proposal development process. It's a very different process. So it is important to start the conversations now, to contact your PRs, to contact CCMs. There is the Global Fund also on his webpage, Data Explorer, has information of the grants. If not, the CCMs should have information on the grants. If not, contact your Learning Hub. And Data Etc. has a website which we will share that talks about who are the key people on the CCM. So there's some data out there that you can already access, but the conversation should start, and also who are the decision makers within countries will be important. We will share other resources such as GFAN has really good resources, and they will keep updating it. You have Change. And just to Daniel's thing, Change will be having a call around these updated timelines and reprioritization on Monday. There was a previous call by the Key Population Networks looking at red lines. So this is the ways we're trying to influence or provide civil society red lines and priorities through the Global Fund Secretariat. So please join the call on Monday, which we will share, and we can influence it. Another way is through your board delegation. So Global Fund has 3 delegations for communities and civil society. Some of them are on the call here. So please reach out to the Learning Hub. And in terms of other challenges or issues that you may be facing, or even trying to contact Secretariat or find out more information that you might not be getting, please reach out to your Global Fund board delegation members. You have the 3, you have communities, developing, and developed. But Ika and Chinmay will share more information on that, on who the members are. So yeah, those are the ones, and the resources will be shared as well. Thank you. Over.
Thank you so much, Chinmay and Kana, for highlighting the next step and resource available. We now move into the open discussion session. I think to help guide our conversation, I'd like to reflect on one key question. What kind of support would be most useful to all of us moving forward, whether it's technical assistance, strategic guidance, or community solidarity? Let's open the floor. Please feel free to raise your hand if you have anything to add.
Seems no one
Yes,
raised their hand.
yes,
I do
please feel.
if low. Okay,
Yes, yes.
because no one raised their hand, I would like to give a few advice to all of you. What I'm thinking, we have to understand first, the deferred, it will take from the 3 years grants. Like Indonesia case, we already implement 1.5 years. So the deferred will take from the remaining budget. So let's say my organization, Spiritia, we are managing almost 39 million USD for 3 years. And we spend almost 100% for 1.5 years already. So now our budget is just become 27 million. So we'll take 50% the identification. Right now, 15% is not decision, identification. So almost 6 million from the remaining budget, which is 27 million. So we will defer for 6 million until the decision come. What it will defer need to be understand for all of us also as a community. The priority essential program and life saving need to continue. What need to defer for procurement? What needs to defer procurement exclude for condom treatment is drug is important. The rest asset information system, TRC, training, meeting who's not directly to the beneficiaries, it's expecting to be deferred or hybrid or changing the method become Zoom, and all the activities should not directly to the beneficiaries to your target, whatever your target, will come to the priority list need to be deferred. So what I understand, it can be different country also, depend on the CCM and PR, but this is the time for you to agreeing them, to telling them it's not cutting one approach, one program, 1 million cut or 3 million cut. It will differ line by line which one that it's not directly implicate to the achievement or to the result of your performance framework. So, but we have to be realistic also. Although we are communities, as a PR, SR, SSRs, some TRC activities automatically will be deferred. That we have to be realistic also when our activities it's not directly what like Indonesian case for human right related, for CLM related, it's we are putting this as a priority, so it's still continue. Thank you.
Thank you so much, Daniel. Does anyone else have anything? Kana?
I think just to add to Daniel's thing, I mean, this is not a proposal development process. We are not adding. We're not. It needs to be transparent and accountable, but it is a kind of grant revision, which is line by line. It's the principal recipients. The board has mandated that the CCMs are engaged. So please, please, I know not all CCMs are perfect. I know there is a lot of issues with CCMs, but this is the time to hold your CCMs accountable or the civil society representative on the CCMs. So it is key. And, otherwise that engagement is going to be missing, and also having access to the documentation. So yeah, over. Thank you.
Yeah. Thank you so much, Kana. Anything else? No? One, two. Kana?
No, is there any CCM representatives on the call? Be great to hear if there is.
CCM member, are you here? Don't be shy. Okay, then I'll take silent as no. Once again, thank you so much, everyone, for your engagement and also reflection. Now we are on the very, very last session of today's webinar. I would like to invite again Rachel on to give the closing remarks. Over to you, Rachel.
I think what's really important coming up from all of this is the fact that there's a lot that needs to be done. I do take Daniel's comments really importantly, and that we hope that our country partners are going to be able to learn from each other, also to share information at a lot more consistently. I'm pausing a little bit because I keep reminding myself the interpretation is still going on. So I think that there was something that was mentioned around making sure that we have raise our voices to before the committee meetings happen, and even before the information sent out. So Daniel, I think some of us will be reaching out to you also to make sure that we follow up with what your suggestions and recommendations as well as advice are, and we encourage our partners also to let us know if there's anything else that we can do to connect you with the right people, or to make sure that things are or information is being shared at the earliest notice. So thank you, and we really appreciate the partnership with Frontline AIDS as well as the 7 Alliance and the Learning Hub for this, and thank you so much to the Global Fund Secretariat for partaking in this call. And we do want to acknowledge very importantly that this is a very difficult time for all, not only our country partners but also our colleagues at the Secretariat.
Thank you, Rachel. Chinmay and Kana, do you have any other last word before we officially close the webinar?
Thank you, Ika. No, I just want to repeat again, please reach out to us if you have any questions, or you want to clarify any questions, or you want to have any kind of discussion related to reprioritization. We will be very happy to respond and talk with you on the same, because this is the important time, and we want that even if we cannot reach out to you, please reach out to us, so that we will be happy to discuss further. Thank you so much for participating. Thank you.
Yeah, thank everyone for the surge. And just to add that this is a new process for the Global Fund. So I mean, if things are prescribed, then nothing is prescribed. There is guidance. So nothing is set in stone, right? So we are going. This is new to everyone. There's not going to be clear guidance or clarification. So very much in the country, no one can say this is what you have to do. So this is the time to protect civil society and community intervention. So please, and we're all here to support where we can. Thank you very much, and thank you to the co-hosts.
Ika, may I get 15 seconds? It's very
Yes.
important information. Yeah, to
Sure.
let you know all of guys that the default it also will take from unexecuted fund. What it means when all the PRs they didn't expand 100%. So the saving it will not allow to to do the reprogramming. It's become part of the percentage will default. That's one. The second thing, the forex gain, it will be part of the default percentage. So whatever the percentage it is, so it will not 100%, 15% from your next activities. It will take from some of the unexecuted fund and plus forex gain. Thank you.
Thank you so much, Daniel. And with that, I would like officially close this webinar. Thank you so much for joining and see you next time. Have a good day. Bye.